services rendered to patients. The CPC exam tests your ability to identify the payer types, rules, and reimbursement methods. Payers are typically divided into public, that is government, and private, that is commercial categories. So let's take first category, that is government payers. Those are public insurance. The first and common one is the Medicare. The most significant government insurer is Medicare. The Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services, that is called CMS, that provides coverage for people over the age of 65, blind or disabled individuals, and people with permanent kidney failure or end-stage renal failure. CMS regulations determine the coding requirements for Medicare and non-Medicare payers alike. So the Medicare is divided into 4 categories. So it is essential to understand the different parts of Medicare, as a significant portion of medical coding is for Medicare beneficiaries. So Medicare Part A, that also called hospital insurance, covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care. Medicare Part B, that also called medical insurance, covers the physician services, outpatient hospital care, durable medical equipment, and other medical services. This is a primary focus for professional coders. Second one is Medicare Part C, that also called Medicare Advantage, a program that allows private insurance companies to offer Medicare benefits. These plans must provide at least the same coverage as Medicare Part A and B. Medicare Part D, this is also called prescription drug coverage, a program that helps cover the cost of prescription drugs. The second type of government payer is Medicaid. It is a state administered and federally funded, provides health coverage for low income individuals or families, children, pregnant women, and disabled. So eligibility varies by state. Coverage and billing rules are state specific. Providers must be enrolled in state Medicaid programs, so generally pays less than Medicare or private payers. The third category is TRICARE, health programs for military personnel and their families, that covers active duty and retired members, reservists and National Guards, dependents and survivors. Fourth category is CHAMFA. It's a civilian health and medical program of Department of Veterans Affairs for spouse and children of disabled or deceased veterans. The fifth category of government payer is Indian Health Service, that is called IHS, serves American Indians and Alaska Natives, includes hospitals, clinics, and health programs. And sixth government payer program is a workers' compensation, covers work-related injuries and illnesses. Employers pay premium to state-regulated programs, includes medical care, wage replacement, and rehabilitation. Does not follow standard insurance billing rules. Example, different forms, pre-authorization may be needed. Second category is commercial or the private insurances. These are non-governmental insurance companies or third-party administrators. Examples are Blue Cross Blue Shield, one of the largest commercial payer in the US. Others are Aetna, Cigna, United Healthcare, Humana. So the characteristics often provided through employers, group plans, or purchased individually. Plans may include HMOs, PPOs, EPOs, and POS plans. I'll explain these terms in the next slide. And coverage and reimbursement rates vary by contract, may require pre-authorization, referrals, or network restrictions. So regarding the managed care plans, as I mentioned here, these are not much asked in CPC exam, but nice to know these things. So the managed care plans, these are the most common types of commercial plans. They are designed to manage costs by restricting patient choices to a specific network of providers. HMO, that means Health Maintenance Organization, typically requires patients to choose a primary care plan, that is PCP, who act as a gatekeeper and must provide a referral for a patient to see a specialist. Out-of-network care is generally not covered except in emergencies. PPO, that is Preferred Provider Organization, offers a network of preferred providers. Patients can see out-of-network providers, but at a higher cost. A referral is generally not required to see a specialist. POS, Point of Service, a hybrid of HMO and PPO. You must choose a PCP, that is Primary Care Physician, from the network, but you can see out-of-network providers at a higher cost. Referrals are often required for specialist visits, similar to HMO. And final one is EPO, that is Exclusive Provider Organization, similar to an HMO in that it only covers services within its network, but it might not require a referral to see a specialist. So the third category is other payer types like self-pay patients. A self-pay patient is an individual who is responsible for the full cost of their medical services. This can be for several reasons. First one is they are uninsured, or they have a high deducible plan and have not yet met their deducible. They received a service that their insurance does not cover. They may choose not to use their insurance. So, in summary, you can see the payer type, funding, and the eligibility and the notes. So, Medicare is federal funded, eligibility more than 65, is disabled or end-stage renal diseases, and it have multiple parts A, B, C, and D. Medicaid is a federal plus state, is for low income, varies by state. TRICARE for from Department of Defense, military members and families, offers prime and select. CHUMP-wise for veterans, families of disabled or deceased vets must not be eligible for TRICARE. And workers' compensation funded by employer funded, eligibility for work-related injuries or diseases, and separate claim process. HMO, PPO are the private funds. They are enrolled individuals. HMO need PCP networks only. PPO more flexible and higher cost. Self-pay is not applicable. It's a self-funded. Anyone can get. They have to pay out of pocket. Let's understand the RBRVS. The resource-based relative value scale, that is RBRVS, is the system used by the Medicare and many other payers to determine how much to pay physicians for their services. Instead of basing payments in historical charges, RBRVS uses a standardized value-based fee schedule. It's designed to make payments for physician services more equitable by reflecting the resources used to provide them. So, RBRVS payment is calculated using three main components, each with its own relative value unit. The relative value unit, that is RVU, is a unit of value assigned to a specific CPT or HPCS code. So, the first one is physician work, that is called work RVU. The physician work component accounts for just half of, that is 52% of the procedure or services total relative value. This component reflects the physician effort, time, and skill. It accounts for factors like the time it takes to perform the service, the technical skill and physical effort required, the mental effort and judgment are involved. The stress is related to the risk to the patient. The second one is the practice expenses, that is called PERVU. The practice expense account for 44% of total relative value for each service. This covers the non-physician cost of running a medical practice. It includes things like clinical and administrative staff salaries, office rent, supplies and equipment, utilities, and other overhead. The third category is malpractice or professional liability insurance, that is called MVRVU. So that is PLA, professional liability insurance component accounts for 4% of total relative value for each service. This component accounts for the cost of professional liability insurance premiums associated with a specific service. So let's see how to calculate using RBRVS formula. So to calculate the final payment amount for a service, all of these components are brought together in a formula. It is crucial to understand how this formula works for a CPC exam. So the formula is payment equal to work RVU into work GPCI plus PRVU into PEGPCI plus MPRVU into MPGPCI and altogether multiplied by CF. Here this GPCI, that is called Geographic Practice Cost Index. This is an adjustment factor that accounts for the differences in the cost of practicing medicine in different geographic areas. There is a separate GPCI for each of the three RVU components, work, PE and MP. So what I am saying is here, this physician work, that is work RVU, and P practice expense, and MP is malpractice RVU. So all three, the different GPCS there, and the conversion factor CF. This is the monetary amount set annually by CMS that converts the total RVU into dollar amount. So let's see the calculation here. So the RBCS payment formula, example calculation. So let's say a procedure has the following values. Work RVU is now 1.92, PRV is 1.73, MPRV is 0.14, and the GPCI for the area, and all three categories. So, and the annual conversion factor, this is decided annually, that is $36. So first we have to calculate the geographically as adjusted RVUs. So for work RVU 1.9, that is work 1.92 multiplied by the work GPCI, that is 1.05. That this amount is coming, and for PE this 1.73 multiplied by 0.98. For MP, 0.14 into this 1.10. So the total amount is sum together, it comes as 3.865. So this is the sum of adjusted RVUs. So finally multiply the total RVU by the conversion factor. So here the conversion factor is $36. So the total RVU is 3.865. So 3.86. So the 3.865 multiplied by 36, it comes as $139.14. So the payment for this service would be $139.14. So this is the end of the payers in RBRVs. In the next part, we will see medical necessity, abuse, HIPAA, and privacy and security kind of things. So please subscribe my channel and stay with me. Thank you.